right. I hope you've been enjoying the show. If you're just tuning in here, don't worry. You can find the archive of this show on YouTube, ACT.tv's YouTube channel. Okay, now for the headlines. Organized labor and reproductive health groups in Oregon, my old home state, are celebrating a big victory. Hard-fought organizing people won passage of a landmark bill to protect reproductive and gender-affirming health care services when provider entities merge, which they are doing a lot of. You see, Providence Healthcare, the largest health system in the area, where I also worked once, is rapidly gobbling up smaller hospitals all around the state, sometimes leaving rural areas with without access to doctors, more healthcare at all. Providence Health Services boast their own venture capitalist funds. They sit on billions of dollars in cash. They pay their CEOs millions, and yet are nonprofits, exempt from taxes, and manage to survive or get even richer as a record number of rural hospitals closed. And perhaps, to me, the most galling thing is that the network is affiliated with the Catholic Church, the poor, loving, meek, supporting, supposedly Catholic Church. It's the very same Catholic Church, by the way, that claims that they don't have enough money to compensate the victims of priest rape they have all over the world. They can't help the kids and the adult kids, but they can build a hospital that gobbles up other hospitals and then profit from it while people go without health care. Okay, back to the big win. Oregon's Equal Access to Healthcare Act now requires insurers and hospitals to demonstrate that mergers will reduce patient costs, which are rising like crazy. They also have to increase access in medically underserved areas and do a whole bunch of more stuff. Deals that could involve a loss of essential services for people, including, and specifically pointed out in the bill, reproductive and maternal health care, which, while I was there working at Providence, they didn't want to provide the reproductive health care part because they're Catholics and, well, whatever. Anyway, if they don't want to do that, that could trigger an in-depth review by the state, and the state would have it reviewed by a board that, of course, includes affected residents and consumer advocates. Affected residents on the board. Affected residents are not likely to vote to ship their hospital to Bend or to let their wives give birth on a park bench. Although some people in Portland might choose that as just an option. Anyway, the board would hold public hearings and make a recommendation to the Oregon Health Authority, which hopefully they would then take and run with. I just want to say again that I once lived in Portland and worked at Providence, and this was before the whole Hobby Lobby thing, before, you know, when one didn't expect religious indoctrination as part of their workplace environments. And during the HR introduction to the hospital, there's about 50 people there, and they strongly encouraged us to put oil on our hands. They did a Catholic blessing, and they gave us an oily stigmata, and it was very awkward. And I moved myself toward the back of the room and slunked out and went to the bathroom because it was weird religious pressure. And that was at a time where they were trying not to give reproductive health care to women. And if they did, they wouldn't tell you that abortion was an option, even if your health was deteriorating. It was a terrible time. Anyway, as the pandemic ushers in a new wave of mega mergers, New York State and the Biden administration have also taken aim at the rising costs associated with hospital mergers. But advocates say Oregon's law is the first to explicitly address reproductive and gender-affirming healthcare access. Because, you know, the Catholics, they don't like women to have a choice in their own personal health care. Way to go, Oregon. I'm proud of you. In related news, marches in 50 different cities across the country will be taking place this Saturday in support of Medicare for All. What are you doing Saturday? The aptly titled March for Medicare for All is demanding the U.S. government do the following. 1, pass improved and expanded Medicare for all immediately. They're not wasting any time. The single-payer healthcare system that they want is one that is free at the point of service to every American, regardless of sex, age, creed, race, religion, gender, identity, citizenship. Citizenship. So given to Americans, regardless of their citizenship status, basically anyone here, disability, geographic location, income, and employment status. They want zero copays, no deductibles, zero out-of-network or in-network restrictions, dental, vision, funeral expenses, chronic conditions, senior centers covered, nursing homes, long-term health, audiology, anything that you need, end-of-life care, maternity, newborn, pediatric care, all covered. Even acupuncture, they're saying they want covered. Full prescription drugs. That's it. No more going bankrupt. Full coverage. They're also asking to recognize healthcare as a human right for all people, regardless of all of those things I said before, including income and employment status, and to prioritize healthcare first in the federal budget. This, of course, includes, but is not limited to, eliminating medical debt for everyone immediately, striking it, funding the single-payer healthcare system, funding wellness centers, nutrition centers, preventative care, improving communities with the least amount of hospitals and clinics, employing more healthcare professionals nationwide, and enrolling future doctors and nurses in schools nationwide, and I might add, based on their ability to be a doctor and nurse in school and not on their ability to pay to go to Harvard or wherever. And here's the thing. All marches have demands, and you say, yeah, so what? They've got a big list of demands. But in this case, if these demands are not met, as the movement says, on or before, or put into motion before Friday, August 6th, which is coming up quick, of this year, the Medicare for All movement is going to be filing a human rights violation complaint with the United Nations. Pretty cool, bringing it to the world, bringing the inhumanity of the capitalist system of healthcare in the United States to the world. I think it's a great idea. And also, here's my take, okay? Medicare for All is a problem for the right and corporations, not so much because they don't want to pay for it, they really don't want to pay for it, but the real reason they hate it is because of what it could lead to, which is corporate responsibility. For example, if every taxpayer, right, left, center, some other party, if every taxpayer had to pay, or even believed they had to pay, to treat the cancer caused by Monsanto using glyphosate on playgrounds and everything else and everywhere else, then perhaps, just perhaps, these same voters who don't necessarily want to take all this money out of their pocket and pay would be motivated to regulate Monsanto's use of toxic chemicals that are costing not only lives, but also costing money. Medicare for All is the very beginning of a sane, humane economic system and governance structure that would force corporate responsibility due to the will of the vast majority of both parties, which is, I don't want to pay to fix things in human beings if the companies could pay for it themselves. If we still have any form of democracy, when Medicare for All finally happens, corporations are going to be screwed, and they know it. So anyway, for Saturday, if you are into any of all this or any of this, and you have a loved one who would, suffer less if Medicare for All passes, which means basically everyone, go to a march in your town. It's this Saturday, July 24th. You can find the locations, information, and a ride at the hashtag M4 all. So M4 all, or at m4m4all.org. It's going to be awesome. By the way, this event is sponsored by a whole large number of people. Black Lives Matter, Catholic Social Action, Green parties here and there, faith groups, and more. I think I have an image that shows where they all are. It was lovely. We'll see if we can get it up here. But anyway, the point is the intersection of all our issues is right here. At the beginning of the show, the main issue here is climate change. The other main issue, staying alive And Medicare for All will hopefully take care of that for people. Our third story that I think you're going to enjoy this evening. Around the time of his space rocket ridiculousness, billionaire psychopath Jeff Bezos made up an award called the Courage and Civility Act that gave one to Van Jones, the TV personality from CNN, but also the founder of Dream Corp. Okay, by the way, go back to the rocket, Phil. Phil's in the background running all of this. We thank him. That rocket, is it not a penis? It's totally phallic. I'm sure when Jeff Bezos was in the meeting about the design, he said, can we make my spaceship look like the penis I wish my head didn't look like? And also the Amazon logo is also a penis. I mean, I guess they were foreshadowing with the rocket and also with the logo, how they were planning to screw us all. Anyway, back to Van Jones. The Courage and Civility Award that Bezos just made up and gave to Van Jones and another guy recognizes leaders who aim high, pursue solutions with courage, and, quote, always do so with civility, which I guess means I'm not going to get that here for this show. Anyway, as part of the prestigious recognition, Bezos gave Van Jones $100 million to give to the nonprofit organization or organizations of his choice. And so some really creative progressive activists are asking Van, because you are a progressive, we understand that you must understand the value of organized labor, the value of fair labor practices and fair payment. So we are asking you to give 10% of your award to the following nonprofit. Athena, which is a coalition working against the undue power of Amazon and the abuse of workers that Amazon does. Oh, wouldn't that be amazing if he did that? I mean, maybe the award would get removed because it wouldn't be considered civil to attack the hand that is feeding you. But that would be so awesome if Van gave $10 million to Athena, and people are trying to make it happen. Go to rootsaction.org. It's the first action you sign up for. Get it spreading, people. rootsaction.org. And also, Van, if you are going to send, that money, make sure you put a giant penis on the envelope. You're watching Act TV. This is Act Now. I hope you are enjoying the show. I'm Julianna Forlano. We're going to be coming to you for now twice a week. So stay tuned to this outlet and share us with your friends. Follow Act TV on pretty much every platform. We got Insta, we got Twitter, we got Facebook, we got YouTube, we have them all. Twitch, all of them. And now we're on Roku and soon to be on Apple TV. I hope you like what we've presented to you. We'll be back next week.